Hi, I'm Sherry Miller Jolly with Dental Support Essentials, and I'm here today, as I am many days, with Dr. Leslie Pasco, the lifestyle dentist. And everyone, Dr. Leslie and I, and everyone has been talking about this coronavirus crisis that has gripped our nation. It has changed our business, it has changed our profession profoundly. Many dentists have stopped seeing patients for routine care and are just now only seeing patients for emergencies. And a whole bunch of us we're home. We're home with our families, we're not in the office, and we're not working like we normally would. And I wanted to come to you today with Dr. Leslie and talk about a couple of things. One is, what can we do? And the other thing is, what do we think about the future of our profession and the industry of dentistry as a whole as a result of what's going to come out of this crisis? Dr. Leslie, one of the things that I felt was really important that you said to me previously is that dentists are not regarded like the medical providers that they are. And in a crisis like this, when we're talking about a healthcare shortage and a healthcare crisis of a proportion the world has never seen before, what can dentists do and what should we do to have dentists regarded as medical providers?
Well, Sherry, that's a super good question. And you and I were talking about this a little bit, which is what prompted us to get on and do this. The first things first is dentists have to change their mind about the profession of dentistry. We're not just teeth fixers. We're doctors of medical dentistry or doctors of dental surgery. We are doctors of the head and neck area. We have much more knowledge than just fixing teeth, and we have many more skills and tools, including bedside manner, to help in crises like this. And I know that dentists have been asked to close their practices and see emergencies only and apparently stay home. But I feel that dentists are being underutilized in a time like this when we have hundreds of thousands of people that need help, and dentists are available now to help. And there's absolutely no reason why dentists couldn't be called upon, not even in a voluntary fashion, although we'd be happy to do so, but regarded, as part of the medical community. I think it comes first with us dentists, we changing our mindset and realizing we do much more than just fix teeth.
I was going to say, I'm not a dentist, as I say on a regular basis, but I have worked elbow to elbow. I have participated in surgeries where bones was being grafted. I have participated in surgery where we're actually changing the patient's entire ability to eat and survive. But I've also been highly trained as an assistant and working in sterile technique and infection control. And I sit here and I think, if a dentist can put someone to sleep, perform the surgeries that I have seen done just in the office every day, and prescribe medication, then they're certainly qualified to assist the medical community in this time of crisis. The other thing that really has just been weighing on me in the last couple of days is, in my state, the state of Ohio, there are close to 6,000 licensed dentists. Well, what kind of difference would 6,000 more healthcare providers make in the fight against coronavirus? And if the goal is that we need to flatten the curve and we need everybody available to not wear out our health system, to not exhaust our doctors and nurses, wouldn't this resource that kind of was created inadvertently by shuttering our practices help? And how I think that it's really important that we get the word out there to our representation.
I agree with you, and I believe that as dentists, we could be the first line of defense. Dental offices could be set up as a pre-screening ground for individuals to ask them questions, potentially take temperatures and ask, the important questions that are needed. Not that all that stuff would necessarily identify, but we could help then pull apart who needs to really be seen and who doesn't at this time. And I think that would stop the overwhelm of the hospitals and, give the healthcare providers the ability to put attention on people who are actually in need, not even just with the coronavirus. There's so many people that need medical attention that we don't want to distract our healthcare professionals from those people either.
And
This could be on the first line of defense for this, for sure. And again, Sherry, we're just completely underutilized here.
I 100% agree, especially now that we have basically reduced our practices to very few patients, if any. That is really important, that we have these doctors out here that could help and should help, but we need to be then given the means by which to do so. I'm really encouraged by some of the unprecedented things that have happened in the speed in which our government has allowed things. There's the American Medical Association came out with recommendations for doctors who can cross state lines now with their medical license. They don't have to worry about state lines. They've tried to expedite medical students into getting their license to have them fight against this. And so now we have yet another resource with these dentists. But there's something else that we need to do. You made a really good point, and I think we have to emphasize this. We're trying not to exhaust our doctors and nurses, our emergency rooms, our that kind of stuff. So we as dentists need to emphasize, well, you as dentists, we as dental professionals need to emphasize that our patients with toothaches and abscessed teeth do not need to go to the emergency room. We need to make sure and communicate with our patients to stay out of the emergency room. And I think there's a lot of tools that can do that. But Dr. Leslie, I know you've started doing that. What have you done in your practice?
Well, thank you. The first thing that I've done is I went online for my Facebook page, and I made a video talking to all of my patients, telling them what to do in case of emergency and that I am still available and I can see them, how to get in touch with us should they need us. I explained and described what an emergency is and why they would need to see me. Also, I set up a system for them to be able to talk to me just like you and I are talking right now, so that I can answer their questions. That's all on my Facebook page at Live Well Dentistry. You can see that. Secondly, I made sure that as we were following what was going on in the news and with what's happening in dentistry, that I stayed in touch through email blasts and things like that with my patients as well, letting them know what to expect. And then last, I have an emergency dental team set up. Pretty much everybody out of the office is on unemployment now, unfortunately, I hate to say, but myself and one other person were designated as the emergency team. So between my 3 offices, if anybody needs to be seen, it goes right to one person, and then we triage from there, and then we bring them into the office if we have to, or we do a teledentistry video like this. And that said, too, I also took this opportunity to invest in setting up a teledentistry site called virtualdentist.online.com. That's still in the process right now. But this way, my patients or anybody who needs help or assistance can access a dentist this way. The president even said that telemedicine right now would be greatly appreciated. And so I'm on board with that. And that's how I intend to help.
Well, and I think it's really important to take advantage of the fact that the government is looking at removing restrictions to bring in people together to work and solve this problem. And it's a whole lot reminiscent of wartime. The president has compared this to wartime. And one of the things that I kept thinking about was the Ford Motor Company, and how the Ford Motor Company stopped making cars and started making B-52 bombers during World War II. And the women, what did World War II do for women? It revolutionized women's in the workforce and things like that. We are going to see changes in dentistry like at the speed we've never seen them. But this is our I believe, a golden opportunity for dental professionals, particularly for dentists, to unify the disciplines and get dentistry recognized as medical, necessary medical care. And I truly believe that this is the opportunity to do that. We're going to have to reach out to our representation. At the end of this video, in the comments, I'm going to place a document of how to get in touch with the American Dental Association, how to get in touch with the National Institute of Health. I'm also putting information on the state of Ohio and the state of Pennsylvania, where Dr. Leslie and I are located, because I think it's really important to emphasize that we have this underutilized group of educated doctors that can participate in this. But one last thing before we go, Dr. Leslie, you were talking about the way things were worded and how dentistry, even by the ADA, was kind of worded as unnecessary at this time. And I do think that when this is all over and when we have helped, that we need to address how that was worded and how that was. I think we need to change the tide. I think that we need to reach out to our representation right now and ask them to push for us to join the fight.
Yeah, Sherry, I actually had to wait several days. I'm one to jump online and share my thoughts, but I had to wait several days because I was a little irritated by what happened. And there was a lot of heightened emotions going on between all these different dental Facebook pages. And I read them for a bit and I had to kind of walk away because it got a little too aggressive at some points for me. And I didn't want to come across that way either. But when I read what the ADA said, that they recommend dentists nationwide postpone elective procedures, and when I looked up the definition of the word elective, this is what it says. An elective procedure is one that is chosen or elected by the patient or physician that is advantageous to the patient but is not urgent. I was, and also too, the dictionary says in medicine, it's chosen by the patient rather than urgently necessary. Well, my goodness, for the last 20 years, the 23 years of my profession, I have been fighting to put dentists in charge of patients' care rather than patients in charge of their own care. And here we are with the ADA, basically, if you look at the medical definition of elective, is basically, more or less saying patients should be in charge here. And while I do believe that patients have a part in their care, patients come to us because we know. And I feel like the way that it was portrayed, that it's elective and that we're elective, and then our governor actually said that he was ordering the closure of all non-life sustaining businesses. And as a dentist, I'm one of those. However, our beer distributors are open. That kind of, it really takes dentistry as a profession back 50 years, where you only went to the dentist when you had an emergency, and now cleanings are just cleanings and fillings are just fillings and crowns are just crowns. And that's not true. I know that I have added years to my patients' lives over the last 23 years that I've been a dentist because they're getting taken care of. This is the beginning of everything. And mark my words, I'm going to make it a mission as I have been. I'm going to continue to make it a mission. And even now I'm more fired up than ever. I want to see the union of medicine and dentistry. And
I think this is our opportunity.
It is. It is our opportunity. And with every great war, not great war, but with every war comes some great changes. This is going to be a change that I'm going to make sure that we see out of this, so that all of the people who have been sick, all of the people who have died throughout the world, that this isn't for nothing. And I believe that if dentists and physicians can come together and work together, our planet would be a lot healthier for it.
I 100% believe that our reaction to this, and as a profession in dentistry, our reaction to this is going to revolutionize how dentistry is done, how dentistry is seen. And it's very, very important that we reach out, that we help, we participate, and we show exactly what we can do to participate in the world. The other thing is, we all need to come together just as humans and citizens to help this. And the more we contribute, Sometimes it's by staying home. Sometimes it's by providing our knowledge and our skill. The faster this is over and the more that we can go back to our lives, because our lives are interrupted right now.
Yeah, what we should be doing right now is helping, not bashing. I understand there's some doctors that are staying open and a lot of doctors that are closed. Find out how we can help those doctors who are staying open so that they can, close if they need to, rather than, giving them grief about it, or, stop giving grief to the doctors who are closed and vice versa. I believe this is a time to come together. If the political parties can come together on something like this, all of us dentists and healthcare providers certainly can.
Absolutely. I think so too. Well, thank you guys for listening to us. I hope that we helped you, or at least sparked some sort of thought in your mind and a new way to maybe use the time we have at home.
Yeah.
Have a great night.